most of the women who are educated tend to prolong having a family, because you want to first finish your education. After your degree, you first want to at least have a job before you get married. And research shows that the most fertile age bracket is between 21 to 25 years. So as you reach 30 years or after 25 with your first job, you're trying to settle down, you start looking for a baby. At 30 years, it becomes a problem. I have an experience of my colleagues, Honorable Winnie Bianyima, who had to get a baby at 40-something. So you can see that for women who are career-based, who want to get education, they will have much more trouble having to get pregnant the first time. But this campaign is much more about what can we do as parliamentarians. And I do think that the two speakers have articulated the cornerstone of the issues. Dr. Lalobo has clearly stated the gap between the developed and the developing world, what needs to be done, the issues around technologies, knowledge-based research on what to be done, the issues around inadequacy of the treatment centers, stating that in Uganda only 5, and I am very sure probably the 5 might be private-based. Therefore, for us as parliamentarians, the question would be, what can we do at the level of the public sector, at the level of the government side, to ensure that the most affected low-income women and men are able to access treatment. Dr. Lalobo and the doctor, the chairperson of the African Fertility Association, has also articulated the need for key reforms. Key reforms, both legal. I'm happy that Kenya has already drafted a bill on that. So they have articulated the need to reform policies, regulations around IVF, regulations around treatment, access. They have articulated it very clearly. So for me, as a woman parliamentarian, I would need to now look at how do we move this campaign forward. What should be our role to move this forward? Looking at the core roles of parliamentarians, I look at one, that we must, as parliamentarians, ensure that our government support the Ministry of Health to encourage that the treatment centers can be decentralized at least to the lower levels and also in public facilities. That is very key to me, looking and hearing what the two doctors have articulated. Number 2, how do we integrate into the healthcare service provision diagnostic center that can ensure correct diagnosis? Because as they have stated, there are several multiple factors. I have even heard psychological can make you infertile if you keep thinking too much. They are talking about infection. They are talking about several, both primary and secondary factors. So how do we integrate this into the healthcare provision to make sure that somebody who goes to a hospital in a district can be able to get the treatment that Nalongo got in Mulago Hospital? I see that as how do we scale up those services in Mulago Hospital to the hospitals in each of the districts, if possible. If not possible at the district level, at the regional referral hospital that we have in the country. I also look at how do we regulate as members of parliament, how do we ensure that a policy is in place to regulate the private diagnostic center for safety of the practices. We have heard also stories of some unsafeness in there. So how do we ensure that these centers are regulated? There are issues of privacy. If you're going to donate a sperm, what privacy will be there? All those issues around safety and regulations of the existing private sector. How do we ensure that we support the ministry, and if the regulation is there, we popularize it to make sure that. I am also looking at the issue of insurance. We are in Parliament grappling with an insurance policy and a bill on public insurance. But with the private insurance, if you look at exclusion clauses in the insurance policy, you will find infertility treatment is one of the exclusion. In all insurance policy, you will find pre-existing conditions among those. So if you are going to have a private insurance, how do we regulate to make sure that insurance policy integrates fertility treatment in their policy? Because most of it is not really your making. And as we debate the public insurance bill, I am looking at how do we ensure that this is integrated in that bill. I am looking at how do we empower the women, because around all this theme of today's campaign is together we can create a culture shift, which means the cornerstone of all this is also the cultural perception. We've heard from the two testimonies. The perception out there, once a couple cannot give birth, the first center point is the woman is infertile. They don't first think about all those other issues associated with male infertility. But culturally, it is the woman who is infertile. Then they start thinking straight away, what are the options of correcting the infertility? In the villages, they will start with going to witchcraft. They will say, oh, maybe somebody died at your place, you did not do the funeral rites properly. Somebody will say, oh, maybe juju. And many women, even educated one, will go to juju to correct infertility. And you take all those herbs and all that, it's happening. So that is culture. They will say, you go to the hospital, you waste your time. Even now in villages, we are finding as politicians those issues around family planning, that some people are spreading this, having perception that family planning is also a cause of infertility. So at the center of this, how do we shift? How do we change the culture? And to me, this is a very, very important advocacy point for us as parliamentarians. We come from each of the districts, the constituency, we reach the rural people directly. So I look at one of our core objectives and role in this campaign to be advocacy, public awareness creation, education on the causes, on where they can go to seek treatment, on how they can handle the whole aspect of infertility. So these are some of the issues that I have picked up as a moving action point for us as parliamentarians, and therefore this campaign requires public figures to come out and join hands in campaigning, in raising awareness, And I want to pledge to you, Merck, that as parliamentarians, we will join this campaign and passionately advocate for a cultural shift towards infertility issues. I thank you very much.